Focus on Health, your weekly dose of health and wealth information on KUTV.
Men are notorious for avoiding doctors and also ignoring unusual symptoms. How does this affect them in the long run? Join me, Bwari Michelle, on Focus on Health as we talk about Men's Health Month, which is celebrated every year in June. Today we are at Bliss Medical Center, where they have amazing offers, amazing services when it comes to Men's Health Month. So where exactly should we create this awareness? Tell us what you know about the Men's Health Month on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. We love your feedback and we'll definitely get back to you. But even before we see Dr. Gabriel on the details, here now is the health update. That was the very informative health update, and with me on set is Dr. Njoe from Bliss Medical Center, taking us through Men's Health Month. We are going to be demystifying what exactly it entails, how to create awareness, and the importance of regular checkups. Thank you so much, Dr. for joining us today. So Dr. even before we head on to our topic today, kindly introduce yourself to our viewers.
Asante sana. I am Dr. Gabriel Njoe, and I am the Chief Operating Officer of Bliss Healthcare.
So Dr. our topic today is Men's Health Month. Maybe Dr. you could guide us on what exactly it entails and what are some of the problems that men face.
Thank you so much. When we speak of men's health, we look at a man as a holistic individual. So we have to look at the physical, the mental, and the social. And to begin with is that, a man is a leader of the society, is born to be a leader of the society, and he has taken up that role, and within the confinement of the role, then there are all these challenges and risks. And particular on men's health, there are some clinical conditions that actually affect the today's man more even earlier than. Like for example, we have cardiovascular diseases. These are the heart and the strokes, hypertension. They account for about 48% of the problems that kill men. Then we have cancers. And the leading three cancers are the lung cancer, prostate cancer, and colon cancer. Then after that, the next one for men is unintentional injuries. Men tend to live a more riskier life than their counterpart, the females, and so they are prone to unintentional injuries. Then you have other chronic diseases like now diabetes, arthritis. Yes, that is the picture that affects the medical picture, the clinical picture that affects the man of today.
So Dr. from your explanation, you could tell that men's health is all-inclusive. Would you say that that is the reason why women tend maybe to even live longer, because they don't live riskier lives?
Women tend to live on average 6 years more than men. So it is correct. Women live longer than men by an average, studies have shown by an average of about 6 years. And it's a combination of factors, not just one factor. There is the living, the style of living whereby men take more riskier lifestyles. Like for example, you find men will drink and drive. Men will take more riskier jobs. They also, because of stress levels, maybe they are the ones who are doing this, maybe drug addictions, they smoke more than women. Men smoke like 12% of the population, and then women like 7%. So you find because of that environment, they tend to live fewer years than women.
So Dr. given the numbers that you've stated right now, we can tell that men's health is on the rise. So why do we not have awareness created more regarding the men's health?
Number one is that men, there is this phrase that big boys don't cry. So they tend not to seek medical advice timely. You'll find a man who is going to work and he has been having this persistent headache for long, and he only takes Panadol because he has to provide for the family. And he never went for checkup for this long, only to get stroke because the blood pressure has been high, causing the headache. Or has been having chest pains, and he only takes some analgesics, some painkillers, some cough syrups, and it's only advanced stages. Then you find an X-ray has been taken, and now cancer of the lung has been found. Has been having urination problems for the last 2 years. He never went for checkup. Then now he's being diagnosed with advanced prostate cancer. Has been having blood in stool, for example, and has not been bothered about the blood in stool, only to find that it is colon cancer when it is late. So these are some of the things that a man will not. Their health care seeking behavior is also requires to be improved. They need to improve their attention to their health. Yes.
So Dr. in the spirit of creating awareness, we know that this is the Men's Health Month, but most of us maybe even don't know about it. So tell us, what is the significance of having it and what is our goal?
Having Men's Health Month is very significant and important to the society. Because we need, as much as we need children to be healthy, our women to be healthy, even the men need to be healthy. The society is composed of all of us. And the disease profile over the last decade or two has changed from infectious diseases to non-communicable diseases, which are affecting men more. So it is very important that during this month, that each and every man becomes aware of himself in terms of risk factors that he or she may be having, and also going for medical checkup. And as Bliss Healthcare, we are now celebrating 10 years. We have made it our priority to ensure that this Kenyan society has a healthy man. And how we are doing it is, number one is that we are subsidizing the screening tests. So we would like each and every man to visit Bliss Medical Center, whereby good history of yourself is going to be taken. Height and weight, so that we can see your body mass index. Are you within the healthy weight, or underweight, or overweight, or even obese? Then once we know, and even your blood pressure, you do your ECG so that we can know how your heart is. If we suspect something, we can also do your ultrasound of the abdomen. CT scans we can do if we suspect you have something that we need to look at the scans. So that then you stand to know where your scorecard is in terms of your health parameters. So we are prioritizing this month to ensure that all our male patients, clients, have the best health education and health examination, diagnosis and management. And not only for this month, we would want to ensure that now we educate them that every other day they are celebrating their birthday. Let them make it a priority. Before they go to cut the cake, let them visit the doctor to be given a certificate that your health is good. Or if your blood sugar is high, then we treat you. And that is physical. But even the emotional part, men are also prone to a lot of stress. We also have counselors. We also have nutritionists. So that a man is advised to be able to identify the stressors and categorize them into two. The stressors that you can control and the stressors that you cannot control. The stressors that you can control, you work around them, avoid them. The stressors that you cannot control, you modify how you react to them. So if someone, for example, is stressing you by shouting at you, then you modify how you react. So that then you have a long life. So we are teaching them, we are going to educate them, and we have been doing this. Then there is the third part, the nutrition part. Some people, and majority of those who are having the cardiovascular diseases and obesity is because they are, and diabetes, is because they are obese. So what we are doing is, we have a nutritionist to take them through healthy diet. We also have someone to counsel them on daily physical activity so that they can maintain their health.
Very interesting, Daktari. We love what you're doing as Bliss Medical Center. So maybe now, Daktari, you could tell us, even for the state, the government, and even us as the common mwananchi, the public, what can we do to create awareness on men's health?
I need to start by thanking the government for, number one, being able to roll out NHIF schemes to all people, and also to encourage those people who are not in employment to enter into NHIF schemes. Make this monthly payment so that you can access healthcare easily. So then for the society, it is the time to know that you don't need to be sick to visit a doctor. You could be walking and you are sick, but you don't know. So it is the month that we need to encourage our brothers, our fathers, our husbands. Let me take you to the doctor to be seen. And especially if you find your father, your husband, your brother has been having some symptoms, it is today. Bring them to Breeze. Take them to their doctor so that they can get a clean bill of health. And if a health problem is found, then the doctor is going to deal with it. So it is time now that each and every member of the society wakes up to ensure that they have good health. Let them be checked. We don't visit doctors because we are sick. It's just like a vehicle. We don't service it because it has broken down on the road. We take it after this marriage, we take it for service.
Well, Dr. that is quite informative and engaging, and we're learning a lot of new things. So maybe you could hold on to that thought as we take a slight commercial break. And when you come back, Dr. is going to be telling us more about men's health awareness. Don't forget to hit us up on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. I will leave you with the Did You Know segment. Do not move a muscle.